Thank you so much for having me. Hi, everyone. As Tracy mentioned, I am the publicity and promotion specialist for the Southwest Regional Cancer Program. We do have someone who is actually a patient educator who would normally be doing these talks. She just went off to have a baby, so I will be stepping in. I will answer any questions to the best of my ability, and whatever I can't answer, I'm more than happy to find you an answer and get back to you. And I'll be giving out my contact information at the end, so please feel free to get in touch with any questions that come into your head afterwards as well. All right, so first off, what is the Southwest Regional Cancer Program? So we are a division of Cancer Care Ontario, and there are 14 regional programs under the direction of CCO. The Southwest Regional Cancer Program oversees the delivery and quality of cancer care in Southwestern Ontario. And we make sure that each individual in the Southwest has access to care that is equal no matter who you are and where you live. So what does a patient educator actually do? So their number one priority is to make sure that all patients and family members have the information that they need throughout their cancer journey. They make sure that healthcare providers are aware of these resources so that they can use them as teaching tools during clinic or treatment visits. Along with patients, families, and staff, we identify gaps in information and develop resources to support learning. So things like pamphlets, videos, classes, events like this one. We also improve communication between the patient and the provider. So what I'm going to talk about today. So we're going to start off by talking about navigating services and resources, because I think right now this is really important, because with so much going on in the healthcare system, kind of knowing where to start is kind of puts you at an advantage right now. We're also going to talk about navigating information, talk about patient and provider communication, which again, given kind of how busy things are and how crazy things are, I think it's more important than ever to make sure you're making the best use of the time you do get with your provider. And then finally, we'll specifically talk about some of the effects of COVID-19 on cancer treatment. So when we ask patients and providers to describe good care, a variety of words come up, things like communication, shared, feeling listened to, feeling like I can trust. One of the most common one is engaged. And a lot of patients tend to say things like, I had the best experience when I was engaged in my care. But the question is, what does that mean? So engaging in healthcare is actions that patients and family members or caregivers must take to get the greatest benefit from the healthcare services available to them. And that creates partners in care. So our healthcare system is person-centered, or it should be, but that doesn't always mean that it allows people to feel engaged. So we're going to talk today about some of the actions that can be taken to help you feel more engaged in your care. But first, let's look at some of the resources that are available to you. So at the London Regional Cancer Program, we have a wide variety of resources, both for patients and for caregivers or family. So we have a social worker who offers emotional, social, and financial support. We have dietitians who help with nutrition during treatment. We have an Indigenous navigator who can help with cultural support for any patients who are from the First Nations community. We also have a patient assistance program, which offers financial support. We have a patient and family resource center, which has a wide variety of information. It's basically like a large library. We have interpreters. We have a drug access facilitator who helps you to understand your drug coverage and how you can make the most of it and making sure that things are covered that should be, and so on. We have fertility counselors. We also have a wig and turban service, and we have the patient family access committee. So what's available in the community? So we do offer chemotherapy close to home. So we have chemotherapy available in places such as Stratford, Wingham, Woodstock, Chatham, Owen Sound, Sarnia, and St. Thomas. We also have Look Better, Feel Better, which is kind of a combination between LRCP and Wellspring. We work with Canadian Cancer Society has the Wheels of Hope volunteer drivers, which is a program that offers patients who are in need of transportation to and from treatment. We have Smokers Helpline. We also have the Residence Inn, which is a program that we have for patients who live more than 40 kilometers away from the LRCP. We offer that at $25 a night, a room during treatment, and we also offer a free shuttle from the hospital back to the hotel. And then finally, home and community care. So then what is available to you at home? So obviously everyone's at home right now. So you have your MyCare binder, which you can access both online, and you can also always ask for a hard copy when you are in the cancer center. We have the telephone triage nursing line. We have CareChart at home, after hours nursing line. We have MyChart and online self-management tools such as Self-Management Ontario and Southwest Self-Management Program. So obviously, there are a lot of things that are available, but we also know that online is kind of where a lot of people start. So I wanted to talk a bit about navigating information online and kind of sifting through the information that you're going to find when you are trying to get some of your questions answered. So if you decided that you wanted to search cancer information, these are kind of some things that you might see. And as you can see, there's really no shortage of websites with claims like these online. And they come up oftentimes in even the first or second page of search results. And it can be really difficult to figure out, how do you sift through this? How do you know what is trustworthy information from experts, or if it's coming from someone who isn't medically trained? Because misinformation is dangerous. It can be difficult for a person to see how misinformation affects them. Sometimes it may be something that we want to believe, and you may find yourself asking, who can you trust? So at the end of the day, your healthcare team is the best place to go for information. Ask them if you've learned something online and you would like to know more about it. They'll be able to give you the most reliable information and can help you to sort through myths and facts. As for websites, and these are not absolute rules, but these are kind of good guidelines, try for government agencies, universities, research institutions, national or provincial agencies. It's important to remember that you are a partner in your healthcare. So take advantage of the information available in your cancer center. So things like the MyCare binder, or things like the resource center that is in the cancer center. It has been all checked by your healthcare team along with people like myself. So that'll help to make sure that it is the best information developed by experts that you can get. It's also really important to come to your appointment prepared with questions for your healthcare team. If you've seen things online, or if you've heard things that you are curious about, it's always great to bring those resources, or jot down what you've seen and make sure you're coming prepared to ask specific questions about things you might have seen. So with all that said, you might still find yourself needing additional information and wanting to go online and not being totally sure if a website isn't legitimate. So this is to kind of give you a bit of an idea of how you can kind of drill down and figure out if something you found is worth reading and looking into more. So as you'll see, we have kind of a column here that's good quality information and questionable. So questionable doesn't necessarily mean that it's not trustworthy or that it's wrong. It just means that it might not be the most reputable source. So you want to just read it with an open mind and with some caution. So things like looking at the purpose of the site, like, are they looking to sell a product, or are they looking to share unbiased information? Who owns the website? Is it owned by perhaps a clinic or a naturopath who might have some vested interest in telling you some information that might not be completely accurate? Looking at the authors and kind of some of their credentials. Looking at the intent of their title. Are they trying to convince you or promise you something like a cure, as opposed to just telling you some information? You want current rather than outdated. So anything more than about 10 years is probably not going to be the most accurate. Any kind of evidence or sources that they can talk about, and then look at their language as well. If they've got a lot of errors, a lot of buzzwords, a lot of things that you kind of know, I don't know that that's totally true, then I wouldn't necessarily trust them. So this is how you can evaluate information online, but the best source of information is your healthcare team. So I know that a lot of people struggle with feeling like the information they're getting from their healthcare team is not maybe always provided in a way that is digestible or easy for them to understand. So sometimes there is a disconnect between the information that's delivered and the information that is desired. Sometimes there's a disconnect because of the language or the communication style used. And it also can come down to the fact that a lot of patients and family members and caregivers are not what we would call health literate. So, a lot of people are literate and well educated, but that doesn't necessarily mean that you're health literate, because healthcare is complicated. There is a lot of jargon, there's a lot of complicated language. And so, while you can be extremely intelligent in a number of areas, you don't necessarily know everything you might want to know about healthcare and health matters. So that's why it's important to ask your healthcare provider questions and to check to make sure that you've understood things correctly. So one of the biggest tips that I would give you is anytime your healthcare provider tells you anything, one of the best questions you can ask is basically to just say, here's what I think I've heard, or here's what I understood what you were saying to mean. Is that true? Because that opens up a door to a conversation, as opposed to you feeling like you have to now try to digest this information and figure it out yourself. So as a provider, it is their duty to make communication as clear and concise as possible. They are supposed to use plain language as opposed to medical jargon. But if their communication is not clear or concise, 40 to 80% of the information can be misunderstood or remembered incorrectly. And the problem becomes that your provider believes that they have told you what you need to know, but you or your family member, your caregiver may feel that you have not understood correctly. And so it becomes kind of a dichotomy of this is what I said versus this is what I heard. So some of the things that can be kind of some of the most notable miscommunications are things like misunderstanding of medication directions, risks for procedures, patients feeling unable to remember instructions or managing at home, unable to recognize complications, or knowing when to go to the emergency department and when not to. So it's important to note that you're not supposed to understand technical or medical jargon, because that's a special language that your provider has learned during their training and during medical school, and it should be reserved for conversations with other medical professionals. And so when we hear providers saying, my patient didn't understand, that's not a fair assessment, because really the statement should be, I didn't communicate appropriately for my patient, for the audience. So this is when we ask, though, that you as a patient speak up and that you state that you haven't understood or that you feel things might be murky, because while it is your provider's responsibility to communicate to you in a way that you understand, sometimes they just genuinely don't realize that they haven't. So ultimately, how can you get the most out of your healthcare? So the healthcare system can be complicated. So some of the best things that you can do are just exactly what you're doing today. So finding out what services are available, learning how to navigate information, asking for clear and concise communication from your provider, and coming to each visit prepared with questions that are important to you. And sort of as you talk with your provider, you'll see that kind of just coming in with this base knowledge and these kind of things going for you already is really going to mean that you can make the most of your time with your provider. So hopefully all that's great. But now I know everyone is kind of curious about COVID-19 and how that impacts a lot of the things that we've been talking about here today. So how has COVID-19 changed cancer care in Ontario? So just like everything else, COVID has had an impact on cancer care and treatment here in Ontario. Some of the things that you may see change as a result are including seeing appointments being delayed or moved to virtual format. So this could either be over the phone or over a video chat. Treatments or surgeries being delayed. If you are coming into the cancer center or into the hospital, you'll see that you'll now need to be passing screening and wearing a mask. Visitor restrictions are in place for both visitors and caregivers. And as much as possible, the hospital is making an effort to make materials virtual so that you can find information that you need online, since you are unable to come in even to our resource center because it is currently closed as well. So obviously this can leave patients and family feeling an increased sense of anxiety or stress. It is totally normal to feel nervous or worried if your cancer treatment plan has changed. One of the biggest things I would mention is that, doctors are looking, your physician is looking at your individual case and making those determinations based on individual patients and not just blanket approaches. But if you feel nervous, if you're feeling anxious, the biggest thing I would say is to talk to your cancer care team about your concerns and about how you're feeling. And, you know, feel free to ask them, why is it that my treatment has been delayed, or why is it that, how will this impact me? Feel free to ask those questions. But if you are feeling anxious, kind of some tips that we recommend in order to help ease some of that anxiety. Obviously, whenever possible, stay at home. Follow the regulations put forth by your local health unit in regards to lockdowns. Remember that, like I said, your healthcare team is there for you. If you're very worried about COVID, I would recommend calling them and asking for some help, and they can always put you in touch with resources as well, if you feel like you need someone to speak with. If you find it upsetting to hear about COVID, really sometimes one of the best things you can do is to limit your time watching, reading, or listening to news stories, because it can become very overwhelming. In the meantime, take the best care as you can of your body. So eat healthy, be active, try to get as much sleep as you can, and try to make time to relax and do any things you can that you enjoy. As much as possible, stay connected with your friends and your loved ones, because there is definitely a link between your mental health and your physical health. So, while social distancing refers to physical distance between people, it does not mean social isolation, and it's important to remember that. And finally, alcohol, tobacco, recreational drugs, all of those things can worsen your health and well-being. So, talk to your healthcare team about that if those are things that you find yourself relying on, or that you're concerned about. So some available resources specifically for COVID. So our local regional cancer program does have a COVID-19 section where we upload materials that are specific to COVID-19 and cancer. Cancer Care Ontario also does have on their website materials, as well as they do quite a bit through social media. The Southwest Regional Cancer Program website does have materials on COVID-19 and cancer. You can also look up other regional cancer programs, because we all kind of are pulling from the same playbook in terms of a lot of this. So they might have resources that you find helpful as well. The Ontario Ministry of Health, and then obviously your healthcare team. So kind of the most important thing I would say is that, it is a very busy time in healthcare. It is very hectic. There is a lot going on kind of outside of cancer care that does impact cancer care. And it might make you feel like, you don't want to rock the boat, you don't want to bother, but your health, you have every right to advocate for yourself. And just because we're in a pandemic, it does not mean that you have less of a right to advocate for yourself with your healthcare team. So, when you have an appointment, a web appointment, your doctor has set aside that time for you. So use that time and come, as much as you can, come prepared with your questions. Make a list if you need to. One of the kind of maybe advantages of being at home is that you can sit down and write down everything the doctor is saying. So, try to take advantage of that time. And if you're feeling unsure, if things aren't clear, please, look at some of the things we talked about earlier in this presentation in terms of, communicating what you've heard and what you think they're saying, and making sure that you really do feel like you've understood everything that they've said. And that's it from me.
Thank you so much, Sarah. That was such an informative presentation.